Peripheral lab draw utilizing the butterfly needle with syringe. Before we begin, we will confirm the physician's order for the lab draw and gather the following supplies: an alcohol prep pad, 2x2 gauze, a tourniquet, tape, a butterfly needle system, either a 10 milliliter or a 20 milliliter empty syringe, vacutainer tubes, a vacutainer transfer device, hospital-approved labels, and gloves. Consult your individual hospital policy in all cases before proceeding. Upon entering the room, we will perform hand hygiene, identify the patient using 2 forms of ID, turn on the overhead light, and place the bed to an appropriate height.
Good morning, sir. My name's John. I'm a registered nurse, and the doctor has ordered that we collect a blood sample to send to the lab this morning.
Explain to the patient the procedure, the reason for the lab test, and when the results can be expected. When choosing sites, first assess if the patient has a contraindication to venipuncture on one of the upper extremities. Such contraindications may include a history of mastectomy on the side of the upper extremity, surgical removal of lymph nodes of an upper extremity, presence of an AV fistula, presence of a PICC line, or other conditions making use of a particular arm inappropriate for venipuncture. Consult your individual hospital policy for contraindications and precautions. Don gloves, open the 2x2 dressing and place within reach. Prepare your piece of tape. Open the butterfly needle package and attach an empty 10 cc or 20 cc syringe, depending on how much blood you need for the lab test. Once it is attached, slightly pull back on the plunger to breathe the syringe. After selecting an arm, apply the tourniquet approximately 4 inches above the location being assessed for an appropriate vein. The tourniquet should not be left on for greater than 1 minute. The antecubital fossa, or AC, is a frequently used site. Clean the site for 30 seconds with an alcohol prep pad and allow to air dry. Do not blow on the site or fan the site. Carefully remove the cover over the needle and discard. Stabilize the vein, taking care not to contaminate the clean site. Prepare the client for the stick and insert the needle at approximately a 15-degree angle, depending on the location of the vein. Flatten out the needle and advance until blood return is obtained in the butterfly needle chamber. Pull back on the plunger and withdraw the appropriate amount of blood. Remove the tourniquet. Place the sterile 2x2 dressing over the insertion site. Press the small black retraction button on the butterfly device with the needle still in the vein. Once the needle is clearly and fully retracted, move the sharp out of the way and apply pressure at the site. Take great care to confirm that the needle is fully retracted to avoid a possible needle stick as pressure is placed at the site. Place tape over the site after hemostasis has occurred, if needed. Detach the syringe from the butterfly system and attach the syringe with blood to the transfer device. Fill the tubes in correct order of draw, inverting each tube if necessary after obtaining. Correct order of draw is very important and should always be followed. Place the sharp in the sharps container. Label tubing at the bedside according to facility protocol. Ensure proper date, time, and initial. Confirm again with 2 forms of patient ID and place tubes in a biohazard bag. Prior to leaving the room, provide for patient safety. Check that the tourniquet is off, the bed is in the low position, the call bell is in reach, and there is no bleeding at the site of venipuncture. Transport the sample to the lab.